My actual diagnosis was February the 14th, 2013, so I won't forget Valentine's Day in a hurry.
Alcura is about the people. It's about the service that we offer to our patients and customers, whether that's the NHS, whether that's pharma, whether that's our pharmacies that we supply to.
Alcura does a variety of things. I think it's probably best known for its pharmaceutical support, but there are other elements to that. More and more we're expanding into services that provide support for patients. We have nurses that provide telephone support, make sure patients are taking their medicine as they should, and we'll send nurses in to train the patients how to administer their own drug, and once they're okay to do that, they self-manage at home. There's also a cohort of patients who will never be independent with their care because they've got a very acute episode of care going on. For example, patients being treated for cancer. If the patient's well, they'll then administer the drug and then provide ongoing support and care for that patient throughout their treatment plan.
I just thought, you got breast cancer, off with your breast. It doesn't go like that. I, in being told I had breast cancer, also got told I was something called HER2 positive, and that's quite a specific kind of breast cancer, and it's very aggressive. But thank God, with all the research and things being done, I'm fortunate I got this magical drug called Herceptin. The first Herceptin is given to you in the hospital, and there's a different department in Christie's that manages the administration of Herceptin. And that was the first time I got to hear that I had an option of being treated at home, which was like, oh my God, home? Somebody's going to come to me in my house? And I wanted to make sure my house was really clean. That's the first thing, which it is. The most fundamental thing was for me allowing somebody into my home to nurse me and for me and them to have a relationship. All I can say is it was the best thing ever for me to have somebody come to me at home. And Paul especially, who was my nurse at that time. Just made it so, I don't get upset, but he made it so much easier to cope with everything that I'd been through. When you think there's no hope, there's always hope. And I suppose Alcura and Herceptin have given me a chance of life.
The feedback we get from the patients is overwhelmingly positive. We have some phenomenal thank you cards that are sent out on a weekly basis to our nursing teams. That just really makes me very proud to be part of Alcura, and the difference that the people make in the lives of the patients that they're treating is immeasurable.
Life seemed to get more like I was living rather than in treatment, having treatments at home. So I suppose Alcura for me and the treatment that I received made me have a normal life at a time when I didn't think I was going to get a normal life.
Our new state-of-the-art facilities here in Northampton give us the ability and platform to really ramp up the service that we offer to our patients and our customers. The larger warehouse gives us the ability to stock more products. In turn, that gives us the ability to provide a much better quality of service to our pharmacies, hospitals and dispensing doctors across the UK.
We've got an end-to-end service that involves an awful lot of people to get one drug to one patient on time. And what we try to do is get it right first time, every time, for the patients to have a positive experience.
What Alcura did was make sure the right staff were giving the right service. And for that, I'm eternally grateful.